Okay, so this is for tying a tourniquet. You want to make things as easy as possible on you, so this is the best way to have it let go quickly. So you bring the tourniquet up, you're going to pull and grab, take your finger, and tuck it just underneath. There you go. And then stick one down and make sure that the one pointing up will be the one that you want to grab. And pressure is relieved because your other hand will be busy when they're starting the IV. So again, comes up, pull, so you're not stretching against the skin, pull outwards, wrap around, finger down, and you're done. Alright, so this is a video for tracking and following up on the vein. So first we're going to do is we're going to put our tourniquet on. Remember to stretch first, pull up and around, stick underneath. So right along in here we've got this really nice vein. We're going to follow this one here, and partly because it actually turns blue and it's easier to see. So the anterior part of the forearm, the veins don't move, as opposed to the posterior part where there's a lot more friction and things move. So if you want to get that vein, then your best bet's actually to be on the anterior surface of the forearm. Now a lot of nurses do like to go where they're able to see the veins popping out of the tissue. This one's a favorite because it's nice and big. Just avoid the bony prominence because that's where the veins move the most. Especially you can be seen here in the wrist. When you flex the wrist, this vein will curl in order to make space, and so that it doesn't clamp itself off when the wrist is flexed. So your best bet then is to find the part where it protrudes out, and you're going to palpate and you're going to feel where the vein goes in the body. So if it bifurcates and splits apart, follow it on both ways to find out where you really want to start it. So I wouldn't want to start here, that I would probably rather start farther up the arm, and I'll just follow it. That way I'm going to avoid all the nerves and tendons in the wrist. So once you've found your area that you want, so I'm going to start an IV here. Remember to give yourself a nice long wipe. When you do this, it makes the skin wet and actually makes things a little bit easier to see if you need to. And then where I'm going to start my IV, I usually just put the tip of the alcohol prep pad there, and that way I know this is where I'm going to go. And you can press it all down, so if the person accidentally moves their arm, then at least the prep pad will hopefully stick to them, and you won't lose your spot, and you won't have to retighten the arm and everything. And it'll save you time. Hi, welcome to part 2. This is the in-depth part of the tips and tricks for starting an IV. First one is bending the needle. What's the point in doing it? So here's the needle from the previous video where I've already bent it. What you want to do is you're going to go in, you're going to hover right in the center, and you push it right down against that piece of plastic, and then bend it. By bending the needle, it provides your fingers more space against the skin. So, to go in and almost completely flush. Whereas if you have a regular needle, the angle for insertion is going to be at a farther, larger angle to get in. And then once you're in, you're going to rub to try and flatten it out, or you're going to work your way through and lift the skin up more. This one, you can come in, you can go absolutely flush and still have space for your fingers to hold on. And that's the reason for bending your needle. Now if you bend it too far, it'll be very difficult to get the piece of plastic past the bend that you've created, and so you need to be conscious of that as well. So find your happy angle. Also, in my first video, I loosened the hub. I find that the manufacturers, it's a bit tight, and so I like to loosen it so that I'm able to thread it if I have to with one finger or with both. Sometimes I'm working on some really difficult veins, and the last thing you want to do is be fighting with your equipment.